Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our skin and our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with the increase in pollution and the increase of stress in a daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Surabhi Sharma, is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS, MD, specializes in dermatology, cosmetology, and tricology. Currently, she is practicing at two clinic as a consultant dermatology at Derma, Look Skincare Mirror, and Paradise Wellness, Laser and Skin, Vasant Vihar. Dr. Sharma has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirements. Doctor is also aware of the need for the patient education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions for us today. Welcome to this YouTube
Hi,
live.
Mona. Thank you so much for inviting me over here. Thank you so much.
Dr. हमारे जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to talk about hair care in current scenario. And whenever we talk about the hair care in current scenario, the very common problem which is faced by all of us is hair loss. And the people actually don't know कि क्या normal है, क्या abnormal है. So with your profound experience, can you please enlighten us today what's normal and when to be concerned for?
Basically, for if you're talking about hair fall is basically if there are more than 50 to 100 hair fall in a day. So अगर
Hmm.
आपके 100 बाल तक गिरते हैं वो नॉर्मल है बिकॉज आपका हेयर एक नॉर्मल हेयर साइकिल के थ्रू जाता है एंड दैट इज कम्प्लीटली नॉर्मल. अगर 100 से ज़्यादा बाल आपके सामने गिर रहे हैं इफ़ यू सी व्हेन यू वेकिंग अप एंड आप देख रहे हो कि आपके पिलो पे बहुत सारा हेयर स्ट्रैंड्स हैं, जब आप वॉश कर रहे हो तो एक गुच्छा आ रहा है आपका बालों का, it
Hmm.
means that it is abnormal hair fall, and then you need to show to a dermatologist or need to address ki why is it happening. That is the difference between a normal and an abnormal hair fall.
ओके दैट्स इंटरेस्टिंग डॉक्टर. सो डॉक्टर, जिन लोगों को हेयर फॉल हो रहा होता है या हेयर लॉस हो रहा होता है तो दे कीप आस्किंग दिस क्वेश्चन टू देमसेल्फ कि मेरे को भी क्यों हो रहा है. सो कैन यू प्लीज एनलाइटन अस लाइक व्हाट आर द जनरल कॉजेस ऑफ हेयर लॉस?
General causes of hair loss is basically if you're not taking care of your diet, if you are seeing that अगर आपका normal vitamin D, vitamin B12 deficiency है, thyroid hypothyroidism है, some medical condition can cause one of the general causes of hair loss. Secondary, if you're going through a lot of stress, so stress can be in the form of physical or mental stress. अगर physical stress means recent surgery हुई है या फिर recently आप pregnant है और आपने deliver किया है, या फिर रिसेंटली कोई बहुत बड़ी बीमारी, फॉर एग्जांपल टाइफॉइड और एनी काइंड ऑफ अदर एलिमेंट लाइक कोविड, पोस्ट कोविड काफ़ी लोगों ने देखा कि हेयर फॉल बहुत ज़्यादा बढ़ रहा है. दिस इज़ अ वेरी कॉमन कॉज ऑफ हेयर लॉस एंड रिसेंट सर्जरी, एज आई टोल्ड यू, बॉडी इज अंडर स्ट्रेस, so it can also cause hair loss. Mental stress, like suppose if your exam is coming and your exam is there, you'll see that 2-3 months के बाद hair fall बहुत ज़्यादा बढ़ जाता है. So these are the most common causes of seeing hair fall regularly. So that can be treated. That will always recover. Whenever the body is under stress, you see hair fall in such situations.
Okay, that's very interesting, doctor. So doctor, you mentioned about diet and these days we're quite busy and the lifestyle is like pretty busy and late working hours and lack of sleep. So, can a personal lifestyle play a role in hair loss?
Definitely. If you're smoking, if you're taking alcohol, if you're having processed food or unhealthy food, lot of sugar, they all have a role in hair fall. So definitely आपका एक लाइफस्टाइल बहुत इंपॉर्टेंट है. आप किस टाइम पे सो रहे हैं, आप पूरा 8 hours स्लीप अपनी बॉडी को रेस्ट दे रहे हैं, नहीं दे रहे हैं, एंड वेदर यू आर वर्किंग आउट और नॉट, what kind of food you are putting in your body. Food is the fuel for the body. तो अगर आप सिर्फ sugars and processed food खा रहे हैं, you're not giving adequate nutrition, So definitely it has a role in hair fall. Hair has an aesthetic significance in our body. Hair is not an organ जिसको function करना है. तो body
Hmm.
सारा nutrition आपकी बाकी body organs पे use करती है, and it does not go to the hair. So
Hmm.
you need to take care of your lifestyle, take care of the food which you are eating, take care कि you not smoke a lot or alcohol intake आप उतना ना करें, and food intake proper रखें, sleep cycle proper रखें, work out करें. These are all the factors which have a role in your hair growth. So yes,
Okay.
hair lifestyle has a role.
Okay, very interesting, very informative, doctor. So, doctor, like now that we know like what is hair loss and causes kya hote hain, and even lifestyle is very important. So, दूसरा very common questions and people are confused because of this era of so many information where everyone claim like we'll give you 100% hair back in 1,000 rupees. So people are quite confused. Like, what are those actual, real medical treatment options available for hair loss? So through this platform, can you help us to enlighten people? Like, what are those treatment options available, like surgical, non-surgical, or any other treatment?
So basically, see, there is a difference between hair fall and hair loss. So if you're
Hmm.
suffering from hair fall, just जो कि 100 से ज़्यादा बाल आपके बस टूट रहे हैं, गिर रहे हैं, you
Hmm.
have to first see your nutritional report, whether you are fine. Vitamin D, B12 हम check करते हैं. All
Hmm.
these things are, if there is any problem, discrepancy, we start you on those multivitamins or those vitamins and minerals which needs to be treated. Some
Hmm.
women has very commonly been seen iron deficiency hoti hai, so we start them on those supplements, and we tell the patient that you will be fine after 3 to 6 months, just
Hmm.
continue with the supplements.
Hmm.
हेयर फॉल बहुत ज़्यादा है और क्रॉनिक हो रहा है तो हम लोशन सोल्यूशंस लगाने के लिए देते हैं स्कैल्प पे, जिससे कि हेयर स्टिमुलेशन हो, हेयर थिनिंग
Hmm.
इंप्रूव हो, एंड साथ के साथ हेयर फॉल भी कम हो जाए.
Hmm.
जब ये नॉर्मल चीज़ों से नहीं ठीक होता, देन वी गिव सर्टेन सोल्यूशंस विच हैव all these peptides like anagain हो गया,
Hmm.
procapil हो गया,
Hmm.
redensil 3% हो गया. All these are peptides which stimulate hair growth, help in reducing hair fall. And
Hmm.
if it is too much of hair thinning, then we definitely add minoxidil. Minoxidil is a solution which is given. It's a medicated solution, has to be taken under a dermatologist and not take yourself. It has to be applied, so it is available in 2 to 5%.
Hmm.
5% is commonly given in males, and females पे हम 2% देते हैं. So these are non-surgical ways of handling hair loss,
Hmm.
hair fall. Now if hair fall इतना ज़्यादा हो जाए कि hair loss भी बहुत ज़्यादा हो गए, means you are now seeing baldness, or
Hmm.
I can see your scalp now. Then we
Hmm.
go to other treatments like oral treatments, where there is oral finasteride available, oral minoxidil is also available.
Hmm.
Then there are certain treatments like GFC PRP nowadays, very popularly done by doctors.
Hmm.
Recently, exosomes have been introduced for stimulating hair growth. And
Hmm.
if the coverage area, the baldness is very high and it has not responded to any of these, we go to
Hmm.
hair transplantation. We have
Hmm.
to see the donor. This is the surgical way. So इससे पहले जो मैंने discuss किया था, these were the non-surgical ways. Now coming to
Hmm.
surgical, if the patient is not responding to any of the non-surgical, or they have a lot of baldness, we go
Hmm.
towards hair transplantation.
Oh, okay. So there are a wide range of treatment options
Treatments
available, and it's
available. Yes,
always better to know the root cause of the problem, get the treatment instead of
exactly,
blindly going anywhere and getting,
exactly.
yeah, the treatment. Okay. So, doctor, now there is one word called nutraceutical which is getting a lot of focus, and people are selling it on various platforms. Like, so what are those nutraceutical, and is there any role of these nutraceutical in hair health?
Nutraceuticals are compounds which are derived from plants. These are not raw
Mhm.
derivatives. These are
Mhm.
compounds extracted and laboratory made. Now
Mhm.
they have become very popular, and especially with the nutraceutical companies. There are certain studies that they do help in a natural way of stimulating hair growth. For example, जैसे मैंने आपको बोला कि we have give hormonal treatments like finasteride हो गया या dutasteride हो गया. These are the hormonal oral medications
Mhm.
जिससे कि हम एजीए मतलब एंड्रोजेनिक एलोपेशिया को ट्रीट करते हैं. वही चीज़ का हमने एक नेचुरल वे निकाल लिया है जो आपको धीरे काम करेगा बट काम जरूर करेगा. So like
Okay.
saw palmetto, it has been seen. We have omega-3 fatty acids available. These are
Mhm.
all nutraceuticals which are used in multivitamin formulations, which have the similar role to all these hormonal medications. They are not at all tampering with your other hormones in the body. They are safe, and slowly or steadily they do help in stimulating hair growth, and
Oh,
their anti-inflammatory, antioxidant action also help in reducing the hair fall.
oh, okay. So
Yes.
there are like they are helpful in getting your
Yes,
nutrition of fulfillment and help you
exactly,
in uh,
exactly.
decreasing the hair fall. So there, apart from these vitamins and minerals, doctor, some people also talk about like macronutrients. So what are those macronutrients? Are they really
So
helpful? Yeah.
yeah, so so nutraceuticals, as I told you, like they are compounds from plants. Micronutrients are by vitamin E ho gaya, vitamin A, vitamin B, vitamin C, D, E. In
Mm-hmm.
For hair fall, we actually focus on vitamin B, vitamin C, zinc, and of course iron ho gaya. Iron we give, and B12 we give. These have certain role in some role in increasing hair fall. So these are micronutrients. मैक्रोन्यूट्रिएंट्स में आपका कार्बोहाइड्रेट्स एंड फैट आता है, वो तो आप जो खाना खाते हैं वो है. Micronutrient deficiency, as I told you, if there is a deficiency of any micronutrient in the body, you need to correct it to reduce hair fall. So these micronutrients like selenium and vitamin B12, zinc, iron, these are the micronutrients which has to be taken care of. If you take care of them and add them in your diet, they
Mm-hmm.
help reduce hair fall.
Okay, interesting. So, doctor, like, are these nutrients required to take as per gender RDA requirement, or we can buy it and take it blindly, like
It
copying
has to
those
be
things?
according to your weight. It has to be according to your gender. It has to be according to
Okay.
your age. There is some recommended dietary allowance for each nutrient. For
Mm-hmm.
example, if you compare a male and a female, the iron requirement in the female will be more as compared to an iron requirement in a male, because
Wow.
females lose blood when they are menstruating, and definitely they are more anemic. So yes, there
Mm-hmm.
is a recommendatory dietary allowance, and these has to be taken as per the RDA. You don't have to
Oh,
take these micronutrients and nutraceuticals 365 days in a year. Do
oh.
discuss it with your practitioner, health practitioner,
Mm-hmm.
your
Mm-hmm.
dermatologist, for how long you have to take it and how much do you need it. Over eating is also a problem, and
Mm-hmm.
over under is also a problem.
Oh, okay. So instead of buying, seeing an attractive ad and buying it by ourselves, even if we don't need it, it's
Yes,
always better to ask the doctor.
yes,
Okay.
yes, yes.
Okay, very informative, doctor. So apart from hair loss, there is another very common problem is the dandruff. And does
Yes.
dandruff really cause hair fall, or dandruff is like completely a different entity?
Dandruff is basically completely a different entity. You need to understand that dandruff is because of it's a dry, flaky, irritated skin, which
Mm-hmm.
happens due to a fungus called as malassezia. So
Mm-hmm.
people who have a very oily scalp, you see that you see that they are more prone to dandruff.
Mm-hmm.
डैंड्रफ से डायरेक्ट हेयर फॉल नहीं होता, बट इनडायरेक्टली कैसे होता है, अगर आपको डैंड्रफ होगा सो यू विल टेंड टू इच योर स्कैल्प, and there, because of the regressive trauma which you're causing because of that itching thing, you'll
Mm-hmm.
start seeing more hair fall. So it's an
Okay.
indirect cause of hair fall rather than a direct cause, and dandruff
Mm-hmm.
is a common entity these days, should be taken care of if you're suffering from dandruff.
Okay, interesting. So, doctor, apart from lifestyle and diet, we have talked about, and another very common thing is stress, which is unavoidable. So, is there any impact of stress on hair health?
Definitely, it has an impact on your hair health as well as your skin health. Whenever
Oh,
you are under stress, be
mm-hmm.
it physical or mental, there is a
Mm-hmm.
hormone called as cortisol which is released.
Mm-hmm.
Cortisol has a tendency of causing your skin to become dry and dull, making you gain weight as well as
Mm-hmm.
making you lose your hair. So, yes, if you are under stress, it does have a role in hair fall.
Okay. So it's very important to manage stress, not only for the body, healthy body, but for the skin and
Mental
hair
health.
both.
Yes.
Okay. So, doctor, there is one nuska which is recommended by all the mothers and grandmothers, like apply oil. to get rid of your stress also. And they also say that applying lot of oil you can get stronger and thicker hair. So what do you think, what's the fact behind this oiling hair is a boon or a bad?
So oiling can cause increase in dandruff. Number
Hmm.
one, if you have an oily scalp.
Hmm.
Oiling, if you do not have dandruff, if you oil your hair, then the massage can only improve the hair, the blood flow to the scalp, and have some role in hair.
Hmm. Hmm.
But oiling has no role in hair growth and hair thickness, and stimulating newer hair growth. Oil
Hmm.
can be used as a conditioner. Oil can be used as a massage to relax your muscles and improve the blood flow.
Hmm.
Oil uh, oil has this much use only. Other than that, oil has no major use. If you like using oil as a
Hmm.
conditioner, coconut oil has been seen to be the best because
Hmm.
it has some anti-inflammatory properties.
Hmm.
So use it for conditioning, use it for taking care of the dry scalp, but do not use if you have dandruff issues. And do see a dermatologist for your hair fall, because oil
Hmm.
is not going to help it. So yes, this is the status of oil in normal hair fall.
Okay, so it's nothing like you will apply a lot of oil and your hair
You
will
will
grow
grow your hair.
long.
If that would have been the case, half of the people would not have any kind of baldness or hair fall. That's the thing.
Okay.
Because half of
Okay.
Indians actually like applying oil on the scalp.
Yeah, yeah, yeah. Yeah, even mothers put lot of oil here. Is लगाओ बाल लंबे हो जाएंगे.
Yes, yes, yes.
Okay. That's very informative, doctor. So now, doctor, my favorite part. Can you give us some important tips for healthy hair?
See, for healthy hair, first understand that your lifestyle, as we have already discussed, take
Mm-hmm.
care of your diet, sleep on time, avoid smoking, avoid alcohol. Don't do too much of it because you will end up, putting your body under stress. Then, of course, do workout. Include things such as salads, green vegetables, full of antioxidants like tomatoes and all these seeds which are available, like flax
Yes,
seeds हो गया
yes.
आपका, chia seeds हो गया, pumpkin seeds हो गया. Eat a protein rich diet. If you're a non vegetarian, you have lot of options like fish, you have chicken, you have eggs. These are protein rich, and definitely you will have good hair. Hair care is also important. The type of shampoo you're using, the conditioning, you have to take care of it because we have a lot of pollution in our environment. So take good care of your hair. Braid your hair before going to sleep, and don't do too much of dry heat styling on for the hair. Avoid very regular hair treatments like keratin or smoothing or rebonding, because these are chemicals which are damaging your hair cuticle. So take this is how you take care of your hair. Take if you have very dry frizzy hair, take regular hair spas, or at least apply hair mask to make them frizz free. These are the ways you can take care of your hair. If you are actually suffering from your hair fall, do try taking care of the nutrition. If it does not help, do visit a dermatologist to have an early solution. Better treat it at the start rather than repenting late, that after a lot of hair fall and then you see hair thinning.
Okay. Thank you so much, doctor. I think those are the wonderful tips, and I think I and all the viewers will try to implement them as much as possible. So, doctor, can we take some live audience questions?
Yes, sure, please help me with that.
Yeah, the first question is, hi, doctor, I'm from Vasantpia. How to take your appointment? I've been recently diagnosed with endogenic alopecia and I'm just 35 years old. Will my will my hair will go all of it, or will they stay? My friends say all of will go. Yeah.
I did not understand the question, Muna. Can you help me with the
I
question?
think he's saying that he been diagnosed with androgenic alopecia, and some of his friend might have told him now, to your hair will, all of your hair will go away, and there is no solution for it. So maybe he's asking for the solution and your appointment.
Yes, yes. So definitely you can call the Paradise Wellness reception. The phone number is available on Google, and they will give you an appointment. I would like to clinically examine you. And if it is actually androgenic alopecia, it is very, very easy and it is very very possible to treat it. Don't worry, you won't lose your hair until and unless it is grade 7. It is very high grade alopecia, which I'm expecting that won't be the case. We are there to help you only. It can be treated. We have a lot of options as we have mentioned today in the talk.
Okay, so there is nothing like to be scared of
Nothing to
if
be
you are
scared.
diagnosed with it.
So
And
much of so many studies, so much of new molecules are available in the market that it is actually possible to grow the hair.
okay, okay, interesting. Another viewer from our audience is he's asking that I'm a diabetic and recently I added insulin, and since then I'm facing a lot of hair loss. Is there any way to manage it?
um, Diabetic and on insulin and hair loss. See,
Hmm.
again, if you are suffering from hair loss, we need to see all the things. Nutritional deficiency, do check your hemoglobin, do check your vitamin D, B12, see if
Hmm.
you have any thyroid. You have to take care of your sugar. uh, I know that the sugar is high and you're on insulin, but we have to take care of that also. You
Hmm.
you can start with some topical lotions. I need to see how much hair fall and hair loss is there, but
Hmm.
at this talk level, at least see your baseline investigations, and then we can move forward and treat it.
Okay, okay. So even they well, everyone will have a solution, but you have to go to the doctor instead of
Exactly.
waiting and
But
letting.
it can be treated if you're diabetic. Yes, it can be treated. Nothing to worry
Okay,
about it.
okay. Another question is, hi doctor, my mother told that if I apply lemon juice, my dandruff will also go and hair fall will also reduce. So can I use lemon juice?
See, it is like a actual ghar ka nuska where people put curd and lemon juice on the scalp. It has been seen that curd sometimes it's fine, but lemon juice I do not recommend. When
Mhm.
you actually have dandruff, your scalp is itchy and scaly and it is irritated. So lemon has citric acid, which is
Mhm.
if you have a sensitive skin and उसके ऊपर if you put lemon, अगर आपने lemon लगाया, तो it can
Mhm.
actually cause more irritation and it can actually cause sometimes allergic reaction or sometimes some exacerbate or increase dandruff later. So I
Mhm.
do not recommend lemon juice. If you want to treat your scalp, there are a lot of anti-dandruff shampoos available in the market. Just go for a shampoo which has ketoconazole or zinc pyridine, or
Mhm.
there is cyclopyrox or selenium sulfide. All these anti dandruff shampoos are not even expensive. Go for those anti dandruff shampoos who will not do any harm but actually improve the dandruff. Don't go for any ghar ka nuska, because sometimes you never know, your skin may react to it because of the
Mhm.
irritative nature of lemon.
Yeah.
That is my point. Yeah.
Yeah. And even सारा apply करके अपना scalp खराब करके and then you reach to the doctor and crying
Exactly, it's better to
and
treat it. Yeah.
yeah, yeah. Okay, that's interesting. So, doctor, I quickly take the last question so that we can wrap up on time. So the last question I'll take is that's interesting question. Like, hi, doctor. My daughter is 12 years old. She has a lot of gray hair at such a young age, and we did everything like turmeric oil, everything to get her hair back to black, but nothing is happening. Is there any solution for her?
So always see the scientific reasons why you are getting a white hair. So there
Mhm.
are some genetic causes. There is some causes which you see later in life.
Mhm.
Now we need to see why the white hair, is it diffuse, is it localized? But
Mhm.
usually it is very common if somebody has a calcium pantothenate deficiency going on, or sometimes it is genetic. You can't do much about it.
Mhm.
Please don't apply turmeric and everything, because it's not going to help. It's not going to help. The
Okay.
turmeric is not going to go inside your skin and actually make your hair black. hair
Mhm.
hair hair comes the blackness or the color of the hair comes from the bulb of the hair, where the matrix is present. So if
Mhm.
the cells are not making melanin or not making a pigment, it won't become black.
Mhm.
Please go visit a dermatologist. We usually give calcium pantothenate supplements. Now
Mhm.
again, these supplements are not to be taken 365 days in a year. Take it for 2 to 3 months.
Mhm.
And there are certain solutions available in which we can medicated solutions which we can you can apply on the scalp. They will help in reducing the rate of whitening of hair. They will at least जो अभी और white ना हो उसके लिए they will definitely help. Home solutions usually does not work, and we need to find out why she's getting white hair. What is the reason? So,
Okay. Mhm.
huh.
So
But these are the
instead of
things which
waiting and
yeah,
applying all, yeah, yeah, the same thing applies. So early intervention always helps. So always go to the doctor.
yes, yes, yes,
Okay.
yes.
Finally, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Take home messages that just take care of your hair, take care of your diet and exercise, and your sleep health and good lifestyle. That much is enough to control your hair fall. If you have any kind of hair fall, and if you feel that it is falling alarm in an alarming rate, or if you see balding, don't
Hmm.
do any ghar ka nuska. Go to a dermatologist. Now everywhere there is a dermatologist present. They will guide you correctly, and then better treat it at the start rather than waiting late when you don't have any hair on the scalp. If you take care of the basic things, you won't have any problem. You will definitely take care. You will get your hair back.
Okay. Thank you so much, doctor, for sharing all your expertise with us today and answering all the questions of our viewers. I'm sure the viewers have found the session very helpful. It was a delight to have you, and thank you so much, doctor, for your valuable time.
Thank you, Mona. Thank you so much. Take care.
And also, thank you, ladies and gentlemen, and the viewers for actively participating and asking so many questions. I could not take all the questions, but yes, we try to manage. But yes, if our doctor have time some day, we'll take our appointment again and create more awareness on different topics for hair or skincare. Until then, doctor, see you soon and
See you
have a
soon.
nice day.
Have a
Well,
nice day. Bye.
thank you, doctor. Bye bye.
Bye bye.